This episode of Dispatches from Planet Albany is brought to you with support by New York State United Teachers, which represents more than 600,000 educators and school-related professionals in New York. Dispatches is also supported by the public affairs firm O'Donnell & Associates. For more information, check out o'donnellsolutions.com.
I've also declared war on potholes, so here's the first shot across the bow.
Well, as you know, with Planet Albany, there's always something that makes the planet turn.
And it's this amazing view of D.C., and Eddie Vedder comes out. And he goes, "You have a cigarette?" And I've never smoked in my life, but if I had, I wish that was the moment.
And this strategy takes us from potholes to knotholes.
I would like to say it was a pleasure, Mr. Kim. But I'm on the road.
I'm David Lombardo, and this is Dispatches from Planet Albany, a WCNY podcast about power and politics in New York. For years, progressive activists and Democratic lawmakers at the Capitol have been pushing the New York Health Act, legislation which used to routinely pass the Democratic-controlled Assembly during the days of divided government here in Albany, that would essentially impose a state-run health insurance program for all New Yorkers. The measure has stalled since the Democratic triumvirate was established in the Assembly, Senate, and Governor's Mansion, and while it has been on the back burner in recent years, there may be increased attention for this policy in light of federal changes that might cause state policymakers to take a hard look at health insurance choices in 2026 and beyond. So in light of that backdrop, we're checking in with Melanie DeRigo, a former progressive congressional hopeful on Long Island back in 2020 and 2022, who is the executive director of the Campaign for New York Health, which pushes for universal health care in the Empire State, and specifically the New York Health Act. Thanks for making the time, Melanie, and welcome to the show.
Thanks, David. It's great to be here. Thanks for having me.
Well, we appreciate you making the time. So before we get into the kind of hypothesis I laid out in the opening about whether there may be more room for the New York Health Act in the Albany dialogue in the future, I'm curious what you see as the biggest obstacles to passage in the legislature since 2019, when Democrats did take control of the Assembly, Senate, and already had the governor's mansion. Is it as simple as opposition from unions, which is what we've heard from the sponsors of the bill, or are there other issues that have been kind of a roadblock that you've had to deal with?
Yeah, that's a good question. I think anytime a legislator is trying to pass a bill that would have such an incredible impact on society, it's important to build stakeholder support, right? I think we can both agree on that. So yeah, I think there were some questions about where labor has been on this bill. I'm excited to say over the last couple of years, we've seen growing labor support, and I mean real support. Of course, the New York State Nurses Association have long been our biggest champions, but the United Auto Workers, Region 9, 9A have come on and work with the campaign in a really significant and strong way. We're seeing increased engagement again from 1199 and et cetera, et cetera, et cetera. So I think, we're having conversations with even unions who have been more, maybe a little oppositional. And I think that's progress, right? Opening the door and sitting down and discussing how this bill works and how it would impact their members, how it would benefit their members, I think is real progress. So I'm really excited about that. I will say that, look, bills like this take a long time to pass, right? Think about the right to vote, right? Think about ending slavery. All of these transformational bills have taken a long time to pass.
You're not putting this on the same level as ending slavery, though, right?
No, I'm not putting it on that level. I think when we think about transformational bills, and I'll share with you, former Assemblymember Dick Gottfried, who is, the author of this bill, he's our father of the bill.
33 years ago.
When he talks about this bill, he does actually say that he thinks this will have that type of transformational effect in the state. He likens it to creating the education system in New York. He likens it to ending slavery because that is the fundamental. No, but here's not because of. Listen, don't try to.
Bold move for a white guy to say.
But I think what he's saying is the dramatic shift in how it will improve people's lives and put us on a more civilized track in this state. That is the seismic shift he sees as this bill. And I fully understand that. What I will say from 2019, look, we have long had the moral argument to pass this bill. We've long had the fiscal argument to pass this bill. I think we haven't had the political argument to pass this bill. And I think that is why this moment is different. I think the harmful cuts at the federal level, the attack on New Yorkers, has opened a window of opportunity for New York to act as a shield against the harm coming from our federal government. It's going to force our legislators to pick a side. Are they on the side of New Yorkers? Are they going to fight for our health care, or are they going to let people die? I think that's why we're seeing this renewed interest right now. And we are. I can tell you from the campaign side, we have seen people pouring into this campaign at the likes that I have never seen in my tenure.
What does that mean?
It means we've had a tripling of our email list sign up. We're getting folks to reach out to say, how can I start a hub in my town? How can I start a hub in my region? How can I organize? What can I do? We've seen more legislators reach out to us and say, look, now is the time. We've got to pass this bill. What can we do?
Like who? What lawmakers have you heard from?
I'm not going to name names. I'm not going to name names right now.
How come?
You'll hear, because you'll see them. You'll see them coming out soon. That we'll be doing town halls with them. They're doing, events in their district. You'll be seeing that over the next couple of months.
Are these lawmakers who weren't already on the bill, or are these new lawmakers?
Lawmakers who are already on the bill but are now making it a priority, which I think is a shift, and that's an important shift as we move forward. But I think that's why you've got organizations like Planned Parenthood getting, really trying to engage with us in more meaningful ways, right? Because there's a 5-star alarm happening right now. It's not hyperbolic to say that these cuts will be devastating. These cuts will result in avoidable deaths. That is the reality. That's what we're facing. We're going to see a doubling of the uninsured population. Hospitals will close around the state. 17 were already at risk before these cuts went into place. ER times are going to skyrocket, and premiums are about to skyrocket. So hold on, David, because in the next month or two, we're going to start to see completely unaffordable premiums where people are going to go without health insurance. And that's just going to exacerbate the problem. Governor Hochul likes to say, we're New Yorkers, we fight back. Well, now it's time for the rubber to hit the road. New York can fight back. As you know, we've had this bill in the legislature for a very long time. It is time to debate this bill in a meaningful way and pass it.
So you mentioned the lawmakers who are on the bill. And one of the things that we talked with former Assemblymember Dick Godfrey about back in 2021 was that there are members who are on this bill who are not supportive. And this is the quote he had. It's kind of annoying that these are apparently Assembly members who are telling the public and me that they're all for the bill, but are privately going to the Speaker saying, oh, not really. And that was an issue we saw with what's known as medical aid in dying in 2025, where Assembly Health Chair Amy Paulin had to go back and sort of double check her vote count. And I'm curious what you're doing on that same question. Are you having to shore up your vote right now, or is that something that you're focusing on more in 2026?
So I think it's a continual process, right? We're always shoring up our votes. We're always checking in with our bill co-sponsors, always, as we try to build support, right? With any bill, you're looking not only to just get the co-sponsorship, but you're trying to move them from a supporter or passive support to champion, right?
Well,
so
it seems like champion's great, but also that there's not undermining the bill behind the scenes.
Yeah, look, I mean,
are you familiar with that, right? I mean, that's obviously on your radar.
Yeah, of course.
Who are the people who are trying to stab you in the back?
Well, they would never admit it, right? I think we have.
Are they like outer borough Democrats? Are they the problem? They're typically the ones who, maybe talk a progressive game but aren't necessarily as willing to believe it.
I'll share. Well, I don't even know that they talk a progressive game.
Okay, fair enough.
I think. Look, what I can share is I have conversations with legislators who aren't on the bill who are like, you know what you're saying makes sense. And I will commit to pushing leadership to have conversations about this bill.
Do you want to name those people?
I want to learn more. No, because we might be close to getting them. And I don't want to turn them away. But look, I think you're right to say something like that. That's very real, right? That's the ugly side of politics that we don't talk about. What I can say is that this moment, I believe, is putting a spotlight on our state legislators. They're going to be in hot seats that have maybe never been so hot before. I think the federal government is hell-bent on harming us. They're not saving us in this moment, right? So whereas typically you see a lot of grassroots organizations jumping in and say, call your congressperson. Yeah, they're still going to call their congresspeople, but I don't think anyone believes that there's a snowball's chance in hell, as they say, that they're actually going to protect us. So we're really trying to push folks to call their state legislators. They need to feel the heat. And I think we're going to soon see, in the next, hopefully, less than a year, but we're really going to start to see where legislators have to choose. They're going to have to choose a side. And it's going to become, I think this bill at this point is an inevitability.
Wow.
And I think I really do. And you can quote me on that and I'll come back when we pass it. But the reality is this: these legislators have the power. They have the opportunity. They have the goddamn responsibility to act and protect New Yorkers in this moment. They have the tools to do so. If they're not going to elect to protect us by passing the New York Health Act, why are they there? Are they comfortable letting their hospitals close? Are they comfortable with their constituents losing insurance? Are they comfortable with knowing that the deaths of New Yorkers are on their hands? I don't think so. And I think sooner rather than later, legislators will come to the realization that this is an inevitability and they will pass it.
So the bill itself has undergone multiple revisions since first getting introduced more than 3 decades ago. I remember back in, I think, 2021, the conversation was, we're amending the bill, we're getting it ready to address the concerns. And then 2023, we're amending the bill, getting ready to address union concerns in that case. Are you anticipating another version of the bill, say, in 2026?
At this point, I'm not anticipating another version of the bill. If you've read the bill, you know that the bill is pretty fantastic. It's a fantastic bill.
Has a lot of unanswered questions in it.
Not really. I mean,
I don't know. When we talked with one of your predecessors about this, that was pretty much the recurring theme of the conversation, which was, they'll figure that out, in terms of implementation. We'll figure this out in terms of implementation. We'll figure out this in terms of implementation.
But I disagree with you. If you look at any other piece of legislation, every single detail of how it's implemented is not in every single bill. And there's a
very
reason
true.
for that.
Very true.
Because we would spend the whole time debating it and nothing would ever pass.
Also probably helps it pass in this case if you don't have to answer some of those hard questions in the bill itself, like a dollar figure.
No. I think we answer hard questions all the time. We lead with truth. We want people to understand. We're very confident in our bill. We're very confident in the benefits and just how many people.
All right, I'm a glutton for punishment then. So how much will this cost, say, an individual business to implement?
Yeah, so we have business calculators that we can share. Obviously, every business is different. There is no standalone. We have X employees making X amount of money. But what I can tell you is that businesses who have, especially for small businesses, right, who don't have super high salaried employees, if you have employees that are not making, $500,000 a year, you're going to make out pretty good on this, right? So
but the bill doesn't spell that out, though.
The bill does spell out a progressive tax, right? Each individual. So let me
sure,
for the
go
viewers
for it.
who don't know, because we're getting into the weeds, I want to back up so we bring your viewers along. The bill is funded by a combination of federal money, right? We get money from the federal government for Medicaid, Medicare, et cetera. And there is a progressive tax, right? So everybody is paying their fair share, right? So what that means for a small business, instead of having to pay the incredibly high rates that they do now, and I don't know how much you know about small businesses in the small business market, but a lot of times small businesses can't even get insurance, right? Because insurance agents say, you're not worth it. We're not going to give it to you. Or they provide insanely high quotes, right? So a lot of small businesses who want to provide insurance can't do that. This is going to level the playing field. It's going to allow businesses to pay a little bit for their employees. Their employees will get their health insurance. And guess what happens then? They don't have to leave that business because they need benefits, right? They don't have to leave that business because they need to pay less for benefits because everybody's paying their fair share. It's a great deal for small businesses.
And you feel like that is all spelled out, that split and the cost in the future, that there's not some ambiguity that would have to be sort of hammered out. Because I remember at one point the legislation didn't actually specify the rates or income brackets for the new taxes, leaving kind of those details to be hammered out as part of the implementation.
So I think what's important to note is that the bill does spell out that it is a progressive tax, right? That is spelled out.
It doesn't say what the rates would be, though.
Let me finish.
Sure.
So the other piece of it is that it does specify that employees can pay no more than 20% of the share. Employers can pay no less than 80%, right? So those pieces are
That's how I like my ground beef.
Right to say that it has not, there in the bill is not specific if you're making 10,000, if you're making 20,000, et cetera, right? It's not spelled out that way because that will be spelled out in implementation, and it will be the governor who ultimately decides the funding mechanism. What I will say is that the RAND Corporation, which you're probably familiar with, did a study a few years ago on the New York Health Act, and they did find that at a minimum, the New York Health Act would save over $11 billion per year annually.
This is that 2018 analysis?
Yeah.
And they also estimated you need a necessary tax hike of at least $139 billion.
Right, but what you're not sharing right now is that money's already into the system, right? I think there's a lot of misinformation.
It's sort of a shifting.
Yeah, this is really important because, and I'm sorry to push on you on this.
Please push away.
We hear this misinformation talking point a lot. Oh, it will cost $139 billion. Yes, but that money's already in the system.
Right.
What we're not saying to people is you won't pay premiums anymore. You won't pay co-pays anymore. You won't pay any co-insurance anymore. So you pay your progressive tax in place of your health premium, and then you never have to worry about paying anything again. And I can tell you as a parent of 3 children, boy, oh boy, would that make my life less stressful. How many times do I have to sit there and worry, oh my gosh, how much is this going to cost if my child, sprains an ankle or breaks an arm? What is this going to do to us? Now I have to pay my sky high deductible because I have a high deductible plan, right? So I think, there is a lot of benefit to this bill. It is not the big scary bill, and I think it's a great disservice to our society that people continue to frame it that way. This bill would have the most positive effect, would do more for every single demographic in New York than any other piece of legislation in the legislature right now.
And how do you sell that then moving forward? Because this is not a new argument. It's not a new bill. We've seen, I think, some good messaging on this. I remember early in their tenure, State Senator Jabari Brisport and Assemblymember Zohran Mamdani had a very tongue-in-cheek video about health insurance, equating it to how firefighters might respond to a fire. Do you need that sort of constant emphasis? Do you need that unique spin that has actually, championed, led Zohran into, becoming likely the next mayor of New York City? Or can it be more of a meat and potatoes sort of traditional advocacy effort?
I think it's both. Okay. Honestly, I think it's both. And what I'll say is, I think our biggest problem is not the misinformation. Our biggest problem is that we're underfunded and we're not able to get our message out. That is our biggest problem, because when we have conversations with people, they learn about this bill and they think it's great.
Where do you get money from this campaign? Is it primarily from NYSNA or other groups?
We fundraise from individuals. We definitely get some assistance from labor unions and other organizations, but we primarily fund, we're a C4, so we're constantly in a state of fundraising. I think if we could get the message out more, I think if we had more paid media, I think if media covered us more, which I think is likely considering where we are in this moment, we will absolutely get the message out more. I mean, I'm going to share a quick story with you. I was at a rally and I was passing out flyers. We were talking about the federal cuts. They hadn't gone into effect yet, the bill hadn't passed just yet, the reconciliation bill. And I talked to this woman and she looked at it and she said, "Oh, I knew New York would come up with something." And I was like, oh, yes, this bill's been around for a long time. But so that is our biggest problem, that people don't know about the bill. This bill is a good deal for everyone. And so when they learn about it, it's a no-brainer. And as I said, I think that, the legislature has a choice, and that choice is coming sooner rather than later. We are excited to build with the legislature, to work with them to move this bill.
For more than 100 years, the New York State Association of Counties has served as the united voice of New York's county leaders, fostering excellence in county government and advocating for sustainable funding and sensible legislation that protects local taxpayers and the essential services they rely on. Learn more at nysac.org. Well, let's talk about the other branch of government, the executive. You've got the support of Lieutenant Governor Antonio Delgado, which may not mean much, right now from a practical perspective, but maybe if he gets elected governor in 2026, it's a big deal. Do you see that as a potential wedge? You can then sort of pry open in 2026? Can you lobby the governor saying, hey, this is going to be an issue on your left. This is something that's going to be a conversation for the primary. So maybe you can get on the train now before it leaves the station without you? Or is that kind of a hard sell, since I don't think this is necessarily going to be something that moves voters? You might disagree with me, but how do you see taking advantage of the support from the governor's number two?
So first and foremost, I would say I actually do think it's a big deal. This is the first time a lieutenant governor has come out in support, regardless of, the political dynamics happening. I think it's important to note that, he came to our press conference in his capacity as lieutenant governor, and I welcome that support. I welcome the support from everyone and anyone, whether it's Democrat, Republican, or whomever. This is a bill that benefits everybody. It should not be attached to a political ideology. With regard to Governor Hochul, yeah, we welcome those conversations. We want her to get on board. Our best interest is linked to her best interest, which I believe is getting on board and moving this bill. You raised the question of, will this be a primary campaign issue? I think that's an inevitability. I think this will absolutely be a campaign issue. And I hard disagree with you here respectfully that this is an issue that won't move voters, right? We've got a lot of organizing happening in every corner of the state. Voters are learning more and more every day. We're bringing more voters in and teaching them. They're learning about this bill. This will absolutely be a bill that will help them decide who they're voting for two reasons. One, affordability, right? This is a bill that puts money back in the pockets of working families. That matters. And I think look no further than New York City to see just how much that matters, right? The second point is that these cuts are going to start rolling out, right? The ACA subsidies, as of right now, we have no reason to believe that they're going to work out a deal. But as of right now, they're expiring, right? So we're going to see incredible increases in premiums. That pain is going to start right at the end of this year, with more pain to roll out in the first half of 2026 and beyond. Once our hospitals start closing, once ER wait times start drastically increasing, this is absolutely going to affect every single New Yorker. Whether you're subject to a high premium or not, it will affect your community. It will affect you.
Are those some of the constituencies you need to bring into this fight, like hospitals? Is there an argument to be made that this benefits you because you have an insured population that's, it's going to be worth your time and effort to treat these people, and they're not going to be so costly as they are under the current system? Because it seems right now, based on the press releases, I'm not seeing their names here. I'm not seeing Greater New York Hospital Association. I'm not seeing Haney's. So do you need to get them on board? And right now, where do they stand? Are they opposed to this?
Yeah, no, I think, look, we do have some good relationships with hospitals. We have certainly have conversations with hospitals. And I think, look, you kind of hit the nail on the head earlier, right? For a long time, this bill has been on the back burner, right? So we are, ramping up as quickly as we can and having as many conversations as we can to welcome people into this coalition and organizations into this coalition. What I will share is that this bill actually has a provision where it increases provider rates above Medicare levels.
That's a good carrot.
That's a very good carrot, right? Especially now, even before these cuts, right? So think earlier this year, we had 17 hospitals, as I mentioned, at risk of closure. Now, because of these cuts, that number goes up to around 80. That's a lot of hospitals around the state that will likely close if nothing is done. The New York Health Act is the answer. The New York Health Act will keep these doors open. And we need to act sooner rather than later, because the New York Health Act is also not a light switch, right? We don't pass this bill January 2nd and everyone has health care the next day, right? There is an implementation period, right? Now, obviously, with a lot of attention and focus, that could likely be up and running in a year. With less attention and focus, it'll probably take 2 years. So the longer they wait, the more harm is done. So with regard to the hospitals, I think, everyone, when push comes to shove, whether you're an organization or you're a human being, you're looking out for your best interest, right? So even if there is a piece of legislation that maybe, isn't your favorite, because of these circumstances that we're finding ourselves in, because of the federal government, because of these cuts, everyone has to reevaluate where they are and choose the best path. I would like to think that they would choose the moral path. If not the moral path, you've got to choose the fiscal path, right? Especially if you're an organization, because that's your whole bread and butter, right? You've got to stay open. These hospitals, right? They have to take care of people regardless if they have insurance, regardless if they can pay for it, right? That's uncompensated care, which is why they're going to close if we don't get them funding. The New York Health Act will do that.
Assemblymember Paulin has said, at least in the past, that she doesn't anticipate moving this bill until all of the outstanding issues are resolved. So it seems to me like she's not intending to have, say, a health committee vote unless she knows it's going to the floor. Is that the right strategy as far as you're concerned? Is this one where you want to have all your ducks in the row and then push it across the finish line? Or do you want to see maybe some incremental progress on this bill, like a committee vote in one of the houses?
Yeah, look, I think at this point, given the harm, all bets are off in sort of your planning stages of what would be ideal, because frankly, what was ideal 2 years ago is not ideal in this moment, right? So I think, from our perspective, from the campaign perspective, we're pushing full court press to make sure that the pressure is on so that we move this bill. If we get a committee vote and then we stall out, that is some progress that we will build on. But as I said, I think this moment is so unique. This political moment is so unique and so different, especially at a state level. I don't know. I don't know that they're prepared for the level of intensity that, constituents will direct at them in this moment. Now, look, I'll be honest with you, and I'm sure you've read the same studies I have. Typically, we don't see public sentiment move a bill, right? It's usually the special interest groups, et cetera. That's who decides which bills move. Why I think this moment is different is because there is such widespread effect on everyone, right? And I think many of us have sort of given up on our federal government in any way, shape, or form helping us. So all of that pressure will be on the state. I don't believe that the state legislators are used to the type of pressure that they will be receiving very soon. And I think that is meaningful. I think that changes something. I think state reps are more responsive to their constituencies than congressional representatives tend to be because they're smaller, they're local, they know their community folks. And I think if we do our jobs right, which we fully intend to do, that pressure will be felt. And as I said, this bill will be an inevitability.
Well, lastly, I want to talk about what that pressure looks like, or what meaningful pressure looks like that doesn't necessarily backfire on you, because we sometimes see from some of the passionate groups, often on the progressive side of things in New York, that they can bite their nose to spite their face and end up alienating lawmakers. So what does meaningful pressure look like?
Yeah, I'm so glad you brought this up. I feel like I preach about this all the time. Look, I think very few times should you be there with your pitchforks, right? I'm a big believer in building relationships and not tearing relationships down. What I think meaningful pressure looks like is constituents showing up and having conversations with their lawmakers.
Showing up at offices, showing up at homes, showing up at when they're out to dinner?
Not homes, no.
Okay.
I would not on that, not homes. No, showing up at their offices, speaking with them at events, wherever they are. We want them hearing about the New York Health Act respectfully. I've never condoned harassment or anything. Good Lord, the political environment that we're in right now, I would never, let me make that very clear. That is not what we're saying. I think using the traditional, tools available to us, sending emails, sending letters, requesting events, writing letters to the editor, making the case for the New York Health Act extremely visible within their districts, right? That's what I mean by meaningful pressure. Because look, I'll be honest with you. I don't think that even some of these, that as you brought up earlier, some of the legislators that are technically on the bill but may not be super supportive, I'd like to believe that if they're hearing it nonstop from their constituents, that would shift something in them, right? I want to believe that. I want to believe that our lawmakers are there to represent their constituencies, right? And at a minimum, I do think that it does affect the majority of them. Right. So I think that will have a registered effect on how they move and operate in this moment. And look, I'll be honest, we're hearing of a lot of primary challengers come 2026. We're hearing about them. People are reaching out to the campaign and we're like, yeesh, right? So I think we're going to see, it's let me say this. It is up to the legislators to choose in this moment. Are they with us or are they against us? Because that's the choice. There is no middle ground in this moment, right? And if they're against us, they're against us. We'll work with them. We'll try to help them see the light. But, if there is someone else in their community that steps up and runs against them on the New York Health Act, that's the bed that they've made. We would like to see the legislators do the right thing. We're always available for, resources to answer questions, et cetera. As I said, I like to build those relationships, but I think this moment is it's frankly a scary moment. It's a solemn moment. I worry about, Americans and certainly New York, but the piece that gives me hope, the silver lining, is that New York can really embody what we all think New York is, right? We do fight back. We don't take it. So why the hell are we rolling over now? We don't need to. So my message would be to the legislature, to the governor, be the fighters that we need you to be in this moment. Be the fighters for New York, step up, pass this bill, and protect our health care.
Well, we've been speaking with Melanie DeRigo. She is the executive director of the Campaign for New York Health. Melanie, thank you so much for making the time, and I look forward to checking in with you after the end of the 2026 legislative session for a autopsy report of either the successful bill passage or the unsuccessful stalled effort.
You got it, David. I look forward to celebrating with you in the future.